Hi, it's Evan Kirstel here with eViRa Health out of Boston. Delighted to chat with a couple of fascinating people today. Firstly, Irma Rastegayeva of eViRa Health. Hi, Irma.
Hi, Evan. Hi, Tim.
And our guest of honor is Tim Washburn, Chief Clinical Officer at Electronic Caregiver. Tim is, among many other distinguished things, a nurse of 25 years, a nursing leader, and a leader at Electronic Caregiver.
Good to see you. Thanks for having me.
Tim, this crisis has hit disadvantaged communities particularly hard, both minorities and socioeconomic areas harder than others.
Sure.
I've been hearing some really fascinating and inspirational work that you and your team have been doing in this area to bring relief and healthcare in general to some of these communities. Can you share a little bit of insight there on what you're doing?
There is this concept, and it's been in healthcare a long time, I think, that the way you fix things is to throw dollars at it. The reality is that because healthcare is an individual choice, the very first thing you should do is the thing I learned back in nursing school many moons ago, right? Which is first you have to seek to understand. So when we think about the disadvantaged population, we think about it very, very differently. And we have a project going with the Native American group in Arizona, in northwestern Arizona. And the concept is that though we could absolutely rent our technology to these folks as a business model, which we do to other folks, and we will do that to some extent, our focus is instead to, rather than just leave it at that, we actually want to help them build their own health services organization. So the proverbial teach them how to fish instead of giving them fish. Instead of just throwing money at them, what if we actually worked with them to hire their own people, their own local people who want to stay where they live, work where they live, maintain that relationship to the family they love? What if we built a business around their goals that leveraged their own people, skilled them up, provided them jobs, provided advanced care, primary care, home health care, telemonitoring, telemedicine? What if instead of giving, we taught? And what if instead of owning, we helped? So when it comes to the disadvantaged with the Native American group, and we're going to start in one place, we hope to expand it everywhere. We're going to be very focused on helping them stand up on their own, using our knowledge and our passion. And, you know, it just fits with our ethics. It's not like this is new to us. It's just a different version of what we've always done, with a little more focus on a very localized plan to help them stand up on their own 2 feet, really help them create their own health services. So we're going to do that. We're getting through the legal piece now, and I can't wait to do a press release. It's going to be amazing. You know, as a nurse forever, I got into healthcare not for money. No nurse gets into healthcare for money. That's just nonsense. I'll tell you, for the most part, no doctor.
You get into it for the pajamas, right? Those great scrubs that you get to wear.
Yes.
I think that's really why you get into it, right, Tim?
I think you're right. And I keep telling my boss I want to wear scrubs. And he keeps telling me that I don't work on the floor anymore. But one of these days, my God, I'm going to wear them into work, and he's going to have to deal with it. But doctors don't get into healthcare for money, most of them either. There's this myth out there that there's this giant health conglomerate machine, and that the doctors and some of the leaders, all of them really, they're just in it for the money. I'll tell you, does that exist? Absolutely. That exists, by the way, in every profession. Government officials, lawyer, I'm just saying, it's all the same. Really and truly, healthcare is this thing that, from my opinion, will be a grassroots effort to change. It'll be individual doctors, individual nurses, individual community members who say, I want telemonitoring. I want telemedicine. I want to build my own Native people's health service organization. I don't want somebody who lives in Washington, D.C., who may or may not really understand my culture at all, making decisions for me. If healthcare is a personal decision, then the change in healthcare we need is going to have to be a community effort. So we focus on understanding the community, or the healthcare ecosystem, of a given customer. And then we work our way backwards in terms of how do we implement things that can help. And it's really cool what we're going to do with Native Americans. Anybody listening to this, if they want to hear more, if they're a disadvantaged population and they want to talk with me, we would love to talk with you. There's things we can do together. We have to change our way of approaching. It's not the patient's fault. It's not the disadvantaged people's fault. We aren't doing it right. Not as right as we could anyway. And so we're just, you know what, at the end of the day, that's the great thing about our company is we're privately owned. We don't have to ask venture capital for the permission to do the right thing. We just do it. And you know, it turns out it's fine to do well, but first you got to do good. And we focus on doing good, and the well comes with that on its own.